It seems everywhere you turn, someone is coughing or sneezing or just sick and they can't go to work or go to school, but there could be relief in sight. At least we hope so. Last week's report from the state health department on respiratory illnesses showed a drop in COVID and influenza compared to the week prior. That is good news for all of us. But what should you do if your child or a loved one or a friend does in fact get sick? Well, Dr. Murali Ramaswamy from Cone Health is here with us today to break it all down. All right, let's first start. We got fevers, we got coughs, we got more. And so let's talk about the fevers first. What are the do's and don'ts when it comes to reducing fever?
Okay, this is a great question, and thank you for that. Happy to be here. So fever is a symptom of something going on within your body, and in other words, a system in your system. And when one feels a fever, it's a good idea to reduce it with Tylenol or Advil as measures to control the fever. You can also use cold compress in order to bring the fever down. But really the question should be, why is one having the fever? If there are other symptoms, that would suggest a respiratory viral infection. And then there are things to do if one suspects a respiratory viral infection.
All right, are there any certain don'ts when it comes to a fever that we should make sure we stay away from?
So the typical thing would be to monitor the level of fever. If it's a low-grade fever and if you're feeling fine otherwise, I think that's okay to monitor. But if it's a high fever, for example, 102, 103, then those are things for concern, and one should reach for help immediately. There are other things that go with fever, such as confusion or severe headache or cough or phlegm or feeling winded or wheezing. If those things were to happen, yes, one should be more concerned that the fever is something a lot more sinister than a simple viral infection that's going to get better.
Okay, and what are the signal, like the temperature degrees that you need to go to the doctor now?
There's no hard and fast rule, but for sure a fever of 103 or 104 is something somebody should go to the emergency room or urgent care straight away, or at least call their doctor on call. But between 100.4 and 102, it's a judgment call.
Okay, and how long should people be fever-free before they go back to school or back to work?
Yeah, that's a great question. And, we're again assuming that the fever is from a respiratory viral infection. So at least 24 hours without fever, one can come out of isolation from a respiratory viral infection. But you could still be contagious. And at least for COVID, the guidelines are to come out of isolation when you're free without fever for 24 hours and then mask for another 5 days.
All right, and are we talking about free without fever without the help of acetaminophen, or free without fever with the acetaminophen?
Oh, that's a great question. So yes, it is fever without the help of any fever-reducing medications. That's correct.
Okay, gotcha. All right, now let's talk about the coughing. So we did fever, let's do coughing. When should you contact a healthcare professional when you're coughing?
Okay, cough is a very normal protective mechanism for a respiratory virus because your body is trying to fight the virus and it's trying to expel the virus out. So it's a very normal protective defense mechanism. So by and large, you want to expect to cough, okay? But when the cough is lasting more than several weeks, or in the acute illness phase, if there is a lot of phlegm, particularly if the phlegm has a color to it, such as yellow color or green color, then one should be worried and contact a healthcare professional. Also, in addition with the cough, if there is shortness of breath, or if you have a finger pulse oximeter and the oxygen levels are low, or if you're wheezing, then you know that there's something more to the cough and one should reach out for help.
Gotcha. Okay. All right. So there are all kinds of over-the-counter medications to suppress your cough, others to break up the cough and make it more productive. When should you take which one?
Okay. Yeah, this is a great question. To be honest, I generally favor any over-the-counter medicine. If there is phlegm and you want to get rid of the phlegm, a Mucinex would be a good option. But if the cough is making you miserable, like Adelsim would work just fine. And these are really what we call palliative measures to feel better. They don't get rid of the cause of the cough, but if it makes one feel better, they should take it.
Mm-hmm. Okay. And so some coughs seem to linger for a really long time. We've heard that a lot over the last couple of years. Do you need to wear a mask when you're around others?
Yeah, so if in the acute phase of the illness, in other words, soon after getting a respiratory viral illness, for the next few days to several days, in the case of COVID, it's at least 10 days, yeah, one should mask so that one is not contagious. But there are people who have what's called chronic cough, which has been going on for weeks and there's no specific reason. That cough is, because it has no reason and it's not from an infection, there is no need for those people to wear a mask. But in the context of a viral infection for the first 10 days, you should mask in order to prevent the spread of the virus to other people.
All right, we talked about the over-the-counter like medicines and stuff, but are there any home remedies that we should be doing when it comes to cough?
Uh, that's a great question. Again, like anything like a soup, warm soup, generally helps people feel better. And beyond that, there's like, no specific actual, treatment from in terms of a home remedy.
Okay, but hydration and definitely the warm liquids make your throat at least feel better for sure. All right, we're going to take a quick break
Absolutely.
and we are going to be back with a little bit more of what do we do when we have one of those respiratory illnesses at home.